All right, good afternoon, everybody. I am your host, Dr. Barry Pierre, your favorite board certified internist, founder of drpierre'sball.com, host of the Lunch Learn with Dr. Barry, and of course, your host of the Empower Yourself for Better Health series. This is episode 61. We are going to be kind of following up along the most recent podcast episode. If you have not had a chance, go ahead and check that episode out. Episode 88, we are talking about physician bias today, especially for my patients who are overweight, obese, and all of the above, right? And of course, I focus on the physicians, but just kind of with doing my research, so to speak. It looks like it's not only physicians; it's a lot of people in the healthcare and healthcare industry that really seem to have a unfortunately strong bias against patients who are overweight for lots of different reasons. And we will be talking about that today. So again, episode 61. Empowerment, Power Yourself for Better Health series. We are talking about, is there an agenda against the fat people, right? Which is patients who are overweight in that regard, right? So first I'm going to do is put a comment for the most recent podcast episode. If you have not had a chance, check out that episode. It's at lunchlearnpod.com. Check that out at your earliest convenience. Right. Okay, there we go. So again, we'll just kind of I want to start things off, again, right in the beginning where we're going to talk about, in the podcast, I talked about 7 steps that your physician can take to decrease his bias, right? And unfortunately, I didn't say take away his bias because that's a very difficult task to do, right? But there is some things that you can do to decrease your bias. And first and foremost, all of the links that I'll be talking about is on the podcast episode. So if you just go to the Lunch Learn Pod, find episode 88, you'll see some links to some of the stuff I'm going to talk about today. One of the first things we talked about when a physician wants to kind of, kill the agenda, right, against overweight patients, right? And again, just to give some background story, I was on Twitter, and there was a patient, not even a patient, but someone who was kind of going through one of the normal Twitter trending topics, and it related to how every time she had to go to the doctor, her physician would point out that she needed to lose weight, right? Regardless of what she went to the doctor for, right? In this instant, I think she was talking about having an earache, right? An earache, and somehow her doctor was able to slide in there that she needed to lose some weight, right? Again, the two don't make no sense whatsoever. But again, and that's what's unfortunate, especially for patients who are overweight, who are obese, is they run into that a lot, right? And again, I wish I could say they only run into that in the doctor's office, but they run into that everywhere, right? To the point where even when they're in the gym, right, people are talking about the fact that they're obese, overweight, and struggling in the gym. It makes no sense, right? There's definitely a problem in a lot of different areas when we talk about obesity and when we talk about patient care. So that's kind of the crux and kind of what kind of led to all of this, right? So first things first, right? We're going to talk about the physician bias. And again, I say physician, but I'm interchangeably saying everyone in the healthcare industry, right? We have a lot of people who have this bias against patients who are overweight for lots of different reasons. Some I think is taught, right? Some I think is innate. And when you combine those two, you run into that issue, right? Where a person could be coming in for, a real medical related reason that does not have to do with their weight. But because we somehow get so biased on that patient being overweight, we think the worst, right? So again, they can have high blood pressure, and we say, oh, well, you need to lose the weight, and your blood pressure is not controlled because you're eating too much, right? We come up with all of these different scenarios strictly based on the fact that this person is overweight, right? We don't think about, well, you know what, maybe this person is blood pressure is high because they can't afford the medication, right? That doesn't come up, right? Maybe this person blood pressure is high because the medication is not working, right? No, it's always no, their blood pressure is high because they're eating too much food, they're taking too much salt. Any different reason you can find to do it, like somehow it gets slithered in there, right? So I think the first thing foremost is kind of eliminating your own personal bias, right? When you're taking care of patients, whether it be outpatient, whether it be in a hospital setting, right? When you're taking care of your clients, right? Especially if you're in the health training where you're working out with patients, understanding that you have to kind of remove the bias that is associated with patients who are overweight. Again, and it's something that it's hard, right? Because when you're in medical school, you learn things. When you're in residency, you learn things. And then you get out into the real world and you have to kind of unlearn those things that you've been learning for the past 3 to 7 years. So that's something that, I think first and foremost, you have to kind of eliminate the bias. And on the one of the links where I talked about kind of these 7 ways a physician can kind of loosen their biasness against overweight patients, it actually wants you to take this test, right, to see just how biased you are, right? And I put a quote out there where I said, if you are if you're biased against overweight patients, right, but you don't know it, right, then how do you know to take care of it, right? So they have, right, first and foremost, they say, just take this test. And again, I'll put a link to the test because I don't think it doesn't. In fact, give me a second. I'm going to put a link to the test right now in the comments because I don't think that is something that only needs to be done by physicians, right? I think a lot of people need to take this and really sometimes kind of look yourself in the mirror and say, wow, okay, I did not realize I was like that bad, right? Because some people, unfortunately, are that bad when it comes to being biased against your overweight friends and family and colleagues and everything else under the sun, right? So I think the first and foremost is, trying to kind of eliminate that bias because we know it's there. Let me see. So the second one, right, and this is very interesting, right? When we talk about patients who you're taking care of who are overweight, right? And again, and you're trying not to blame everything on the weight, right? You have to understand that there's a lot of different reasons why this patient can be having problems, right? That is not related to the weight. But it's up to you as a physician, as the clinician, as the nurse, it's up to you in that position of power per se to try to look for those reasons, right? I think saying a person is overweight and that's why they're having the problem they're having is a quick scapegoat. That's easy, right? But it usually isn't the one that's more effective. Usually isn't the thing that works, right? So again, very important to really think about all of the different reasons, right? Like again, you got this person who comes in with an earache and you're talking about the weight, right? No. There's a lot of different areas that you can explore before you say, you know what, that's the reason why the weight is where it's at, right? So again, really making sure that, as a physician, right, you're getting tested, right? Like that means you're looking for all of the different causes and then you're saying the weight, right? It was funny because when I did on Twitter, right, because I talked about podcasts, I got a little trouble. One of my follow-up questions, right, was a person who comes in for knee pain, right? And knee pain is, especially if you have osteoarthritis, especially for my patients who are watching this and those who are watching this with osteoarthritis, you can have some knee pain and your knee feels better if you lose a little weight or you're off your feet, right? Just being off your feet in general, you're going to have less knee and foot pain. So I pose a scenario. What is this person coming in for knee pain? And I want to say their weight, right? Like, again, as a physician, right? You have to put yourself to the test. You have to say, you got to hold up that mirror and say, you know what? Yes, saying that this person's weight is the reason why her knees are bad is an easy way. But let me make sure I eliminate all of the other different reasons for that, right? So again, making sure that as a physician, clinician in the healthcare field, that we're making sure we're looking for all of the different reasons why your person, the patient who's coming to see you, could be having the problem they're having without having to automatically blame the weight is extremely important. This one, of course, as a osteopathic physician, right? I love this, and of course, in this full disclosure, the article that I got these steps from was in the do.osteopathic.org, right? So of course, but for those who don't know, one of our catch sayings, right, as an osteopathic physician, which I absolutely love, is that we're like the holistic physician, right? Like somehow we've been able to snatch that from the MDs, right? So if I'm a DO, patients like, oh, you're a DO, or you're holistic. You look at the whole body. Now, let me tell you, I know a lot of MDs who also look at the whole body, but I'm gonna be honest. I like the fact that people really only associate that with DOs, right? I'm just gonna be honest with you, right? So they only associate that DO. So where I'm happy, I'm not gonna complain whatsoever in that regards, right? So looking at a whole picture of what other different reasons may be associated with her obesity, right? With this person's obesity could be the cause of their problems, right? It's extremely important, just as important as well, right? So it's a lot of different things that you can do when you want to kind of put yourself out there as far as trying to find out what's causing your patient's pain, discomfort, and everything else under the sun. Give me a second. All right. All right, sorry about that. So again, be holistic, physicians. Like, there's really no, it's easy, it's simple. Like, think about everything. And again, this is something I usually have to get on my residents about being holistic and thinking about everything. In that regards, right? So be holistic. Being a holistic physician, again, is another way to look at an opportunity to look at, like, hey, what else could my patient be going through that's causing them the discomfort, without automatically saying, no, it's your weight, right? And I'm gonna talk about this toward the end, right? Like saying it's your weight is a problem, especially in the patient's eyes. Next up, and this I almost hate that I have to put this up, right? But, like, be empathetic, right? Be cordial, be like caring, understand that your patient has probably heard that they're overweight countless of times before they came to you, right? Like, again, I even said this. I said, you are not surprising any overweight patient by telling them they are overweight. I 100% guarantee you that, right? Like, you're not, pulling a fast one. They're not trying to pull a fast one on anybody. They understand they're overweight. They understand they have problems, right? But again, they're just coming for the earache, right? They're really not coming to hear about them being overweight, right? They just like, hey, my ear hurts, right? So fix my ear pain. Then we can talk about the weight at a later time, right? So again, again, I hate that I even had to say it, but just be empathetic. And as a physician, you would think that would be something that you would have to do. Yeah, you would think that would be something that you have to do as a physician, to be empathetic to your patients. Unfortunately, that is not the case, right? Unfortunately, a lot of physicians kind of lose it or never had it, which is why the physicians who have it stick out so much, right? That's why, like, for those who are watching, right, you probably know a physician who you're like, you know what, I love that physician. I will follow that physician wherever that physician goes, right? Because that physician just has something different about them that makes them better than the other ones. I tell people all the time, if I had an outpatient practice, one of the reasons why, as a physician, as a hospital medicine guy, right, like, they don't want us having an outpatient practice, right, like close to the area, because they know if you do a good enough job, patients will want to just come see you after they leave the hospital, right? They won't want to go see their doctor that's been, annoying and being such a terrible doctor, right? They don't want to see that. So definitely important to think about. Yeah, definitely important to think about when we talk about, being empathetic to your patient, right? Because again, they've heard that they're overweight. They understand that they're overweight. 9 times out of 10, they tried things that did not work for them, right? And again, they're just coming here for something that has nothing to do with their weight, but you keep reminding them, right? And unfortunately, especially when I was doing my research for the podcast, right, I came across a couple articles of people who just stopped going to the doctor completely, right? They stopped going to the doctor completely because they could never get through an appointment without their doctor mentioning weight, right? And I'm almost sure it wasn't the fact that they mentioned the weight, right? But I'm pretty sure it was the how, right? And that's where us as physicians really need to kind of look at ourselves, right? And understand, like, how are we talking to our patient? How are we communicating with our patient? So that when we actually say something, our patient will want to do it, right? So again, the empathy is a big one that I don't think gets talked about a lot, because I think most people assume that physicians and clinicians and nurses and everybody else in the healthcare industry is empathetic, and that's definitely not the case, unfortunately. This is a good one, right? Acknowledgement, right? This is especially when you're in the healthcare field, and you're taking care of patients who are overweight. Um, Actually acknowledging that, hey, like, I know, right? Uh, you're overweight, and I know you're obese, and I know you probably tried a whole bunch of different trees, and they probably didn't work right. And I know that, and I understand, but understand that I'm still here to help you, right? And I think that's when you start talking about, like, how do I approach my patient who is overweight and talk to them, right? It's really in the approach, right? Like, you have to first acknowledge the fact that, yes, they're overweight, and I'm pretty sure they've tried some things, and not to say that it was their fault, but to say, I'm here to help, right? Like, you're not here to say that, oh, your blood pressure's high, you need to lose weight, then we walk out the door, which happens, unfortunately, right? You're here to say, yes, I see you're on these fluid medications. I see you're overweight. What can I do to help you, right? Like, that's the conversation starter. Because I remember when I was doing outpatient medicine, I used to have a lot of tough conversations with my patients. It used to be a lot of tough conversations, right? And I think, especially me being overweight, I think a lot of times they would be almost like taken aback, right? Because they were like almost shocked that I would even bring up the subject, because I guess they figure, like, oh, well, this guy's overweight, so he's probably not going to talk about my weight. And they're like, nope, here I go. I said, hey, by the way, I see, a little bit overweight here. What can we do to help? What have you done in the past, right? It was always a good conversation starter. We got some laughs out of it. Some people gave me some crazy looks, but we laughed afterwards, right? Because they understood that I cared about them losing weight, and not because it was some checkbox I need to mark off, like, oh, is the patient overweight? Yes. I put my top to them about it. Like, no, it was like, no, I see that you're overweight, and I see you got all these problems here. Let me take care of all your problems here, and how can I help you with the weight, right? Like, that's how I always preferenced it, right? I would say, yes, here's your problem. Here's problem number A. Like, here's your earache. Let me take care of your earache. Oh, by the way, come back in a couple of weeks when your ear is done. Let me see how you're doing, and then we can talk about your weight, right? Like, that's kind of how you need to preference it, right? Does it get done that way? No, unfortunately, but at least you can try in that regards. And again, this understanding, I think, kind of goes right along with the empathy, understanding that to lose weight is a big deal. Just like when you have high blood pressure and you're taking medications and you don't have high blood pressure, that's a big deal, right? To lose some weight, right, takes a lot of different things that you as a physician, the clinician, the nurse, like you in that position, may not even understand, right? Let's talk about just from a locale standpoint, right? Like, you telling your patients, like, oh, just go eat better, sounds absolutely amazing advice, until you realize that the nearest grocery store that has good fresh produce is out of their way and they can't get to it. So, but to get to that, they got to go through 3 fast food restaurants and corners. Like, they got to go through all of those steps just to get to the healthiest place, right? And they can't afford to get past all those steps, right? Because they're hungry, right? So again, making sure that this is where that holistic approach comes in, right? This is where like you're thinking about everything. You're thinking about, okay, medication wise, food wise, can my patient, like, what's my patient's living situation? What can I do that's actually can fit the patient, right? Like, this isn't something that is a one size fit all type thing, right? Like, this is something that has to be tailor made for your specific patient, right? Because if you think, like, oh, I'm just, patient needs to lose weight, here's a medication, here you go, it's not going to work, right? Especially if that medication costs so much money that your patient's got to choose that medication or feeding their kids, right? Like, that's an easy answer choice, right? Like, your medication's not getting your take, and then they're gonna come see you in a month or 2 months, and you can see that they're still the same weight, and you're like, oh, this patient is quote unquote non-compliant, right? This patient doesn't listen to what I say, like, because I told them to lose some weight and they didn't want to lose some weight, right? But you didn't actually acknowledge the fact that that medication you gave them was so expensive that they never could have taken it anyway. You didn't acknowledge the fact that they are nowhere near a gym, right? So they can't just go work out, right? That doesn't make, again, you have to acknowledge all of these things first as a physician. Right? And this is where I think we lose a lot of patients, right? That we're so oblivious in our world, right? Especially, first of all, we're only spending like 15 minutes with them anyways, right? So in 15 minutes, you're trying to get through everything. And then in that little last 30 seconds, you're like, oh, hey, I just noticed your weight's still high. Take this medication, then you're out the door, right? You're not explaining to them. You're not telling them the importance of it, right? So you're doing all of these things that does not help the patient, right? So that's obviously something we can't do in that regard, right? So again, just be understanding of your patient. Understand that your patient has a lot of different things that's going through, whether it be psychologically, mentally, socially, all of these things here that they need to deal with, that they would love to deal with. Like I said, it's not like they don't want to deal with their weight. It's just at the moment, it's not usually priority number one, which again, for the most part, I am very understanding for. And then, especially for my healthcare nerds, right? Be very judicious in like how you're telling your patients to lose weight, right? Like again, I see this all the time online, where people who are not overweight, right, are consistently just bad mouthing the people who are. Like, oh my God, I went to the gym today and the gym was packed with all of these New Year's resolution folks, and this fat lady was in front of me. Like there's always like a derogatory statements towards people who are overweight, right? What you never hear, right, from them is a solution that they can actually pick up and go, right? Like you never hear any of that, right? So it's just always talk. Physicians do the same thing, right? So they're always telling the patients you're overweight, and if you're overweight, your blood pressure not going to be controlled, your blood sugar not going to be controlled, your cholesterol not going to be controlled. They always tell them all of those things here, but they usually don't spend any time giving them any evidence on what you can do that fits you to help lose weight, right? They usually rarely go into that depth, right? And that's what we have to eliminate in the healthcare industry, right? We have to eliminate this need to want to tell people what's happening and then walking away, right? Like, no, you can't do that. Like, if you're gonna say, hey, you need to lose some weight, you also need to tell me like how to lose some weight, right? Again, it makes absolutely no sense in the world. Like you telling me like, oh, we should do this, and then you should lose some weight. Like that's usually the thing. Oh, go lose some weight, and then you just kind of leave them out there, right? Because they may want to know like, oh, what can I do to lose some weight, and you have nothing to tell them, right? And most of the people usually don't, right? Most of the people usually have nothing to say but just negative feelings, right? And unfortunately, we have to remember that physicians, right, are regular humans too, right? Even though it sounds crazy, right? They're regular humans too. So, a lot of their bias that they deal with from home, deal with outside the hospital, creeps right into their medicine care, right? So they don't understand the importance of it. They don't understand that, no, they should be really talking to their patients, understanding their patients, being empathetic with their patients, giving them like evidence-based like treatment modalities, right? Whether it be exercise, whether it be talking to them, whether it be certain foods that they should avoid, right? Like that's always the first thing, right? Especially my diabetic patients. Those are the ones always give me the tough problems, right? Because a lot of times you want to tell them to lose weight, but you understand that their disease of diabetes makes them at an increased risk for being overweight, right? Like something that again has nothing to do with how much they're eating or drinking, right? Is still causing them to gain weight, right? And you have to explain that to them. Say, hey, you're diabetic. You're gonna be more prone to gain weight. That's just unfortunately the way the cookie crumbles for just the way the cookie crumbles for your diabetic patients. But there are some things you can do to try to combat that, slow it down, right? We don't do none of that. And I think especially going into 2019, and because you already know it's about to start happening, right? We're in December, so New Year's resolutions are going to start kicking up. Me personally, I have an agenda. I feel like a lot of this stuff starts like post Thanksgiving, right? Because that's what usually occurs, right? You after Thanksgiving, you come back home and you realize like, wow, I ate a lot of food for Thanksgiving, right? And then Christmas is coming right around the corner, and you still kind of depressed because you ate a lot of food for Thanksgiving, and then you're like, you know what? January 1st, we're losing the weight, right? Like that's usually so. If I had to pin, like I was that's my theory, right? Nothing, no studies have been done. Please don't do a study on it. I know the medicine world loves to do stupid studies, right? Please don't do a study on it. But I have a theory that most of your New Year's resolutions, usually, especially for those about losing weight, usually start bubbling up after Thanksgiving, right? Because they have the turkey, they have the ham, they have all those desserts, they have all those great foods, and they usually don't. Usually we're off, right? So usually you're not doing anything, and usually you gain a couple pounds. I can tell you in the hospital, we know around Thanksgiving time that we're going to get certain admissions to the hospital. Usually your congestive heart failures, renal failures, the people who they know they shouldn't be eating that much salt, but they eat salt anyways. So you tend to get that in that regards, right? So again, we understand, right? It's just a thing that you have to do, a thing you have to learn, and you should, especially as the consumer, right? Who the patient is, right? The customer, right? Patients are customers. If you're going to people in the healthcare industry, right? Doctors, nurses. Like if you're going to, offices that clearly have a bias against you, right? The open enrollment ends December 15th, which is like next week, right? Next week, next Saturday, open enrollment ends. So don't forget that. Again, sorry about the side note. But again, if you're in a space, a health space, right? Because again, we talked about this fat agenda for physicians, right? But honestly, when I did my studies, even the medical students, right? Like they're starting to look all the way down to when they're students, medical students, nursing students, dental students, pharmacy students, all of these people in the health industry, even when they're students, they're being taught and learning biases that just kind of brings them along. So when they're a dentist, when they're a pharmacist, when they're the physician, the nurse, and it's still there, right? So that's what we have to eliminate from that standpoint. They're really to kind of get this ball rolling and to really help people, right? Because if our goal is to help people lose weight, right? These are just some of the things we got to fix ourselves, right? We got to fix ourselves first. We got to fix our system first, and then come to them and say, "Hey, I'm ready to help you. Let me help." So again, just a quick little recap. Episode 61, Empower Yourself for Better Health series. We were talking about the fat agenda. We were talking about the bias against patients who are overweight and obese. It was more of it's a piggyback of the most recent podcast episode 88, where again I talk about a nice story of what happened that would kind of prompted all of this to kind of come to fruition. So check that out if you have not had a chance. Episode 88, lunchlearnpod.com. The link is in the comments. And if you go to the episode page, you'll see a link for all of the studies I posted. There's an article there of a lady who stopped seeing the doctor for 10 years because of the anxiety and stress of going to the doctor, knowing the doctor was going to say, "Hey, you're overweight. What are you going to do about it?" Was so much that she said, "You know what? I'm not going." Right? 10 years. We talked about the 7 steps that physicians need to take. I put a link to that test to see if you're biased against overweight people. Like, please, in fact, like that link actually has a list of about, I think, 10 or 15 different biases, I believe, on that site. I think the overweight one was the second one, right? It said something about like fat face or something. So check that out. Go ahead. I think it'll be very interesting for you to see and look at yourself, right? See how biased you are in that regards, right? So episode 61, Empower Yourself for Better Health series. I'm your host, Dr. Pierre, board certified internist, founder of drpierresblog.com, host of Lunch Learn with Dr. Barry, as well as your host of the Empower Yourself for Better Health series. I'm going to see you guys next week.